It's good to have you join us. Welcome to the program. COVID-19 infections across the world gained by nearly 300,000 new cases to reach 35.527 million. The number of deaths also increased by a couple of thousands to now stand at 1,044,633. Global recoveries added over 200,000 more to stand at 24,777,000. A check on the top 5 log shows the U.S. retaining the prime position as the most impacted country in the world with 7.4 million, having added nearly 41,000 new cases. India is next with 6.6 million cases, adding less than 12,000 new cases. Brazil retains number 3 with a distant 4.9 million, while Russia is at number 4 with a distant 1.2 million. Lastly, Colombia stays at the bottom of the top 5 log with 862,000 cases. At home, the NCDC is confirming that about 538,315 samples have been tested so far, which includes 120 new cases confirmed for Monday, October the 5th. This adds up to 59,465 confirmed cases nationally from 36 states of the Federation. Nearly 50,951 persons have recovered, while 1,113 others were not so lucky as they have died from complications relating to COVID-19. This is COVID-19 Myths and Facts. Welcome to the program. And I will recall our report. Inbound passengers to Nigeria are complaining about challenges they face while trying to meet government requirements on coronavirus testing on arrival from other countries. Some of the passengers have alleged duplicated charges for the COVID-19 tests in laboratories they have not been able to find. Lillian Izamark reports.
Inbound passengers to Nigeria going through health and immigration protocol at Lagos Airport. Some of them are not happy about the difficulties they face over the federal government's guidelines on COVID-19 PCR tests before entering the country. Some have alleged that the process is a scam to extort Nigerians and frustrate travelers who are eager to reconnect with their families. Passengers are required to remain in self-isolation on arrival and carry out COVID-19 tests in designated laboratories 7 days after arrival. The process must be registered on the Nigerian International Travel Portal www.nitp.ncdc.gov.ng. But many passengers have expressed frustration in accessing the portal. The cost of the test on arrival and inability to trace the laboratories. We logged on to the portal to verify the claims of the aggrieved passengers. Nigerian Civil Aviation Authority had announced a limit of 200 passengers on a flight that arrive in Nigeria, but no limit to outbound travelers. Also, airlines that flout the federal government's order of airlifting COVID-19 patients to pay $3,500 per passenger. According to Lagos Airport Command of the Nigerian Immigration Services, 300 flights departed the Lagos Airport on evacuation services, while 25,735 passengers were involved in the evacuation exercises. Since the reopening of the airspace on the 5th of September, the airport has experienced 99 departure flights and about 10,000 passengers were outbound. Within the period, 93 flights arrived the country with at least 11,000 inbound passengers. Lillian Izamark, TVC News, Lagos.
Now let's get more perspectives on this, according to the report by my colleague Lillian Izamark, as I welcome the Director General of the Nigeria Center for Disease Control, Dr. Chikwe Ihekwazu. Dr. Ihekwazu, we're glad you could join us on today's edition of Myths and Facts.
Thank you very much. It's great to be on your show.
So let's begin with the recent drop in the number of COVID-19 infections seen so far in recent weeks. Is this a sign of hope or concern?
It's a sign of continuous optimism about the response so far, but also a sign of extreme caution that we all have to take as a country. At the beginning of your report, you mentioned the millions of infections around the world, over 1 million deaths so far. So while we are grateful for our ability to manage the outbreak in Nigeria so far, we have to realize that once this pandemic is going on anywhere in the world, we are at continuous risk and have to keep up our efforts, even if there's a feeling of relative relaxation. So the challenge for us as a collective, as Nigerians, is not to let down our guard, but to continue working hard to sustain the efforts that we have made collectively as a country to respond to the outbreak so far.
But some scientists, some experts also say that this could also be as a result of the possibility of inadequate testing. How do you weigh in on this?
Yes, increasing the number of tests we do in our country is our collective responsibility. At the federal government level, we have ensured that we have testing facilities across the country. Tomorrow, we should be able to announce that the last state in Nigeria now has testing facilities. All our labs are well supplied with commodities, reagents, and everything they need to do the testing. We're working with our colleagues at the state levels to collect samples from whoever has symptoms and ensure that they get tested immediately. So we continue to make efforts. Lots of people, I can understand, are tired of the situation and are no longer coming forward as often as they should be. And I continue to encourage all Nigerians that we're not out of the woods. And even if we were, there's still lots of cases happening around the world. So we've got to keep pushing. We're not testing enough, but this is not as a result of our inability to test or reagents or labs. We have set up an infrastructure across the country, and we're ready to keep working to support and make sure that we're in a position to test as many people as possible. So we keep pushing, and that's really the motto of this response, not to let down our guards and to ensure that we continue making testing available to all Nigerians.
And we're all hopeful in that regard. Now, speaking of tests, the validity repeat tests for inbound passengers into Nigeria, there are complaints trailing that some government and laboratory officials are making illegal gains off this procedure, which compromises the credibility of the entire arrangement. DG, have you received such reports, and how is the agency handling this?
So thank you. We've seen similar videos circulating across social media platforms. I have two important things to say. Firstly is, why did we introduce this platform in the first place? Our international airspace was closed for months. We needed to support the reopening of the Nigerian economy in order to support and sustain livelihoods. In order to do that while staying safe, we had to introduce measures to prevent a scale-up and escalation of cases in Nigeria. We've done that successfully. We've now opened flights for about 2 months. We haven't seen a spike in cases in Nigeria. So we've achieved our primary goal, is to limit the introduction of new infections into our country. Secondly, on the inconvenience caused to a few passengers, our data shows that 95% of people using this platform actually use it fairly successfully without any problems. So yes, there have been 1 or 2 occasions where there have been issues, but you can take my word to the bank. The Nigerian government is not making any money out of this. Whatever is being paid is paid to the private labs that are doing the testing. We have managed the charges, that these charges are lower than are being paid in almost any other country in the world. We do appreciate there have been a few difficulties. We continue to address each of them. We have an email response site, travel portal at ncdc.gov.ng. If there's any problem, please write us. We respond to every single query and make sure we continuously improve the services that we collectively are providing to the country. So this is a small inconvenience, but it's an important step to prevent a resurgence of cases in Nigeria, which nobody wants. So I continue to appeal to Nigerians in diaspora, those traveling, to please bear with us. This is a necessary part of reopening the economy. There's no other way we could keep the number of cases in Nigeria low, while at the same time supporting the reopening of the Nigerian economy for us to sustain our efforts in ensuring that livelihoods are sustained while responding to this global pandemic.
You talk about costs that, in fact, in some countries, compared with what Nigeria is paying, it is insignificant. But we've had our correspondent talk to some inbound passengers into Nigeria who say that the test is almost at no cost and they get the results almost immediately. Why can't Nigeria have the same structure? And then while you're answering that, I'd also like you to talk about the cost, which is said to be 50,000 naira. Why is it that expensive?
So thank you. I'll challenge anyone that says it's a no cost in other countries. It costs £250 to do exactly the same test in the UK if you're going to travel. So tests cost money, reagents cost money, labs have to keep people employed, and it's being delivered by the private sector. So they do have to recover their costs. It's impossible to provide a service for free. So this is a small price to pay if you have to travel. And at the same time, we want to keep Nigerians safe. Our goal is really, the primary goal of this is not because anybody wants to make money. The primary goal is to sustain the very difficult gains we've made with this response. Everyone has said, listen, Nigeria, we've done well collectively so far, but we are also always cognizant that the gains are very fragile, and we have to sustain these efforts. So we continue to appeal to all Nigerians. This is actually a service that is designed to support Nigerians, to make sure, enable you start traveling again, but travel safely. And so, we've kept the cost as a minimum. We've made the process as efficient as possible. We continue to improve on this every day. And so a lot of the complaints earlier on about people not getting their QR codes and all of that have basically disappeared. So we continue to work very hard to make sure the experience of Nigerians is as smooth as possible and ask them to bear with us. But, everyone is committed to making this system work for us, short term and long term.
All right, DG, Nigeria Center for Disease Control, Dr. Chikwe Ihekwazu. We thank you very much. There are more questions for you, but we'll look forward to another opportunity. Thank you for contribution and time on COVID-19 Myths and Facts.
Thank you very much. Thank you very much.
And that does it on today's edition of the program. Thank you for watching. Do remember, whatever you do, stay informed and stay safe through the pandemic. I am Bukola Samuel Wemimo. Bye for now.